Hey everyone, we wanted to put together a video to answer people's questions about COVID-19, our current coronavirus pandemic. We're going to try to answer questions about how this got started, what's the progression, what can we do, what about vaccines. We're going to try to answer all those in the video so that we can stop answering them individually and hopefully put your minds at ease a little bit and give you some things that you can do going forward to protect yourself. I work at multiple facilities. I have multiple interactions with people every day with substance use disorder as well as just in the real world. And so this is actually made for anyone who wants a little more information on COVID-19. I want to start off with a quote by Winston Churchill. We look at our times that we're in right now and everything's getting canceled. I see things on the internet about Armageddon, end of times, all of that. I don't believe any of that. And I think our reaction and how we respond to this will define who we are going forward. And so I'm a huge Winston Churchill fan. And Churchill was in the bunkers in London. London was getting bombed by the Germans all around him. And it was very dire circumstances. And Churchill, in response to those dire circumstances, said this. He said, "Let us therefore brace ourselves to our duties, and so bear ourselves that, if the British Empire and its Commonwealth last for 1,000 years, men will still say, this was their finest hour." And I happen to believe that this is going to be our finest hour, how we respond, how we take care of ourselves and our friends and neighbors. So with that said, let's dive into COVID-19, our coronavirus pandemic. And just to let you know before we get started, the information that I give you today is all gleaned from credible sources. The people I follow, Dr. Anthony Fauci, who led the United States response to the AIDS epidemic in the 1980s and 1990s and into the early 2000s. The White House task force led by Vice President Mike Pence, the Surgeon General of the United States, Dr. Jerome Adams, and then Ohio Governor Mike DeWine, who has been 3 steps ahead of just about everyone when we look at our current pandemic. So with that said, let's get started.
Okay, question 1. What is COVID-19 and how did it start?
COVID-19 is a novel coronavirus. Coronaviruses have been around for a long time. There are multiple different sicknesses that come out of coronaviruses. Honestly, the last time I heard of coronavirus was my second year of med school in virology. But they cause things like SARS that we had a few years ago and is still around, severe acute respiratory syndrome, right up to the common cold. Now, most viruses, I had a definition of a virus was it's genetic material wrapped in bad news. And that's a pretty good definition. So viruses have to have a host in order to live in. They can't live on their own and replicate on their own. But when they have a host, either an animal or human or basically anything that it can hijack that host equipment in order to replicate itself and cause the issues that it causes. So 75% of new infections arise out of animals. So an animal will have a novel virus and it may or may not make them sick. It's only certain viruses that can jump species and jump into human beings, which is what happened with COVID-19 in the Hubei province of China in Wuhan City. And so you had a virus that originated in an animal, likely, that changed itself and allowed itself to jump from an animal to a human. Now, at first, the response in China was, well, this is coming from animals and it's only transmitted to humans, but the virus quickly became very slippery and started to allow itself to be able to jump from human to human, which is why we see current spread in between humans.
How does COVID-19 spread?
COVID-19 is spread through respiratory droplets and off of surfaces from touching. So some of the strategies that you see about keeping proper social distance, at least 6 feet, avoiding groups of more than 10, that's really around stopping how we know this virus spreads. It can hang in the air for up to hours, up to 3 hours is what I've seen, and it can stay on surfaces for sometimes days. So when you see these mitigation strategies like maintaining social distance and being able and cleaning surfaces, it's around stopping the spread of the virus, because once the virus invades and attacks and starts to hijack our own cells machinery in order to replicate itself, and then it can cause not only its bad effects, but then allow itself to be transmitted to other people. And the other thing we need to know about COVID-19, because I've seen on the internet, oh, this is just a common cold, it's no worse than the flu. That is absolutely not true. Governor Mike DeWine, in an update earlier this week, related that COVID-19 is twice as contagious as flu and 20 times as deadly. So this is not something to take lightly. We want to pay attention to the advice we're getting from the leadership and experts in our country.
How long before people get sick after they are infected with the virus?
Well, this virus spreads really easily in crowded places. So you see some of the mitigation strategy put forth in the United States was to shut down large venues. I'm a huge NCAA basketball fan, but shutting down the NCAA tournament was exactly the right thing to do. So we know that it spreads really easily in crowded places by respiratory droplets, by touch, particularly when we're not practicing social distancing. So the range of time that you're exposed to you get infected is anywhere from 2 to 14 days. So that means I'm exposed today, anywhere from 2 days from now until 14 days from now, I can start to show symptoms. The problem is I'm infective that whole time. So as soon as I'm exposed, the virus starts to replicate inside of me, then I'm capable of spreading to the other people even before I have symptoms and before I know the virus. Now the median time is 5 days. So she said, well, what are your chances if you're infected? What's the most likely day that you will become symptomatic? It's around 5 days. So if you can have the virus and spread it before you're even symptomatic, then by the time you figure out you have a problem, you're already behind the 8 ball. Dr. Anthony Fauci said this week, by the time you realize you have a pandemic, you are already behind where you think you are. And that's why you're seeing the response that you're seeing right now. I keep seeing people on the internet and social media going, oh, this isn't very bad. I only have this number of cases in my county. We don't have any cases in the county I live in. And that couldn't be further from the truth. We have the virus in our community now. It's spreading undetected, silent. It's not like an invasion from a foreign army. We don't even know this is happening. It's happening right now. So when you have cases in your county, you have exponentially more number of cases higher than the cases that you know about. And therein lies the problem. So as we go forward over the next 1 to 2 weeks, we're going to get a more clear idea of how many cases of COVID-19 we have in our country and why this is such an issue. I promise you that the response to this is not overblown.
Who is at risk?
Everyone is at risk of getting the virus. It becomes a matter of how severe is the infection that you get. From what we know right now, looking at China, looking at South Korea, looking at Germany, Italy, some of the places that we have data from, we know that the majority of the people will get only mild disease. Some of them won't even know they ever have it, even after they've recovered from it. But the problem is they can spread it to people who are at risk. And anybody can get deathly ill from it. Anybody can die from it. But the most likely folks are the elderly, those with underlying heart, lung disease, those with any kind of underlying health issues that compromise their immune system. So I think about diabetics. I think about people who have undergone chemotherapy. I think about people with HIV disease or chronic hepatitis C, anything that can compromise your immune system. So the problem is not that, oh, this is mild, I don't have to worry about it, it's not going to hurt me. And I see that response from a lot of millennials. And keep in mind, millennials make up the biggest proportion of our population right now. Well, while that may be true for most of the millennials, what about your grandparents? What about the people in your life you know who have some of these underlying medical illnesses? It can not only cause severe disease, but it can be deadly for them in proportions 20 times higher than the flu. So the real key to spread at this point in our mitigation strategies is millennials. Will they buy into what we're telling them? Will they abide by the quarantine efforts that we're talking about? Will they distance themselves socially? And to the extent that they do that will be the extent that we're successful in containing COVID-19.
How do we control a new virus?
Well, when you have a novel virus, and keep in mind a novel virus just means a virus that none of us have seen before, and that's the problem with COVID-19. We don't have anybody that has seen this before, and thus we don't have anybody that has immunity to it. So when one of these viruses like this springs up, and it proves that it can jump from an animal to a human, and then even worse, it proves it can jump from human to human very easily, more easily than the flu, then we have two big strategies. The first one is containment. Can we contain it where it is? So when this thing popped up in China, in Wuhan City and the Hubei province, that was our best effort at containing it. As soon as it breaks that little area and starts to spread throughout China and then starts to jump borders, then containment is out. And now we're talking about mitigation. How can we mitigate community spread? So once the virus jumps the border, starts going to all countries, and everybody knows how mobile we are in the world today, it doesn't take very long to start to jump borders, and now it starts to spread in communities. So now you have people getting it in communities that have no known travel to China or anywhere near China. And so at that point, the strategy becomes mitigation, and that's what we have right now. The strategies that we're putting out there are mitigating strategies. So what we want to do is we want to slow the spread of this virus because nobody has immunity to it. So if you think about it, the virus can be in a community, we get it, we get immunity to it, we're no longer can be affected by it. If enough people get that, then the virus runs out of hosts that it can infect. That's the goal, although we don't know clearly whether or not we have immunity to this virus after we get it. We don't know how long it lasts. There's a lot of things up in the air. But right now our strategies are mitigation, and we want to slow the rate at which people get the virus so that we don't overwhelm our healthcare system and affect our ability to take care of the folks who can get severely sick and even die from this virus.
What is herd immunity and how do we get herd immunity?
Right. So we just covered that we've got a new virus that nobody has seen before, doesn't have immunity to it. If we get infected with it, we hope that we build immunity, and then after we recover, that we can no longer get infected. So if enough of the population, which for our purposes we'll call a herd, gets this virus and recovers from it, then the virus will no longer have a place to go and it will die out. So there's two ways to get herd immunity. One is everybody gets the virus, right? So everybody gets the virus, they recover, then the virus doesn't have anywhere to go. The other way is through vaccination. So when I see COVID-19 compared to flu, I shudder a little bit inside because we have a lot of people that have been vaccinated against the flu. So you're going to limit the option that the flu virus has to attack. And then people also are getting the flu. Your body starts to make antibodies because it's seen a similar virus before. It doesn't take long to get immune to the flu virus, and now you have a rapidly expanding herd that's immune to this virus, and it runs out of places to go. The problem with COVID-19 is we don't have any innate herd immunity, and the only way we can get immunity right now is to have the virus and recover or wait on a vaccine. So how long does it take for the vaccine? Well, the good news is that phase 1 trials of a vaccine started yesterday, which is lightning speed. The little bit more difficult news is, even in a best case scenario, speeding things up, it's going to be about 18 months. So we're looking at the fall of 2021 before we have a vaccine that's ready for widespread use.
So why not just let everyone get it and then we would all be immune?
Right, great idea, and I heard that early on, right? If this is just like the common cold, which I've seen on the internet quite a bit, it's not like the common cold. But if it is, why don't we just let everybody get it? Well, the problem is it's not the common cold. It causes much more severe disease. And then a significant portion of our population who are at high risk, like I just said, are not only going to get severe disease, but they're going to die. So you're talking about hundreds of thousands and potentially millions of deaths worldwide just by letting everybody get it. Not to mention the fact that you overwhelm your healthcare system with this number of cases. So just letting everybody get it is not an option. The mitigation strategy we're talking about is our best path forward.
How long will this last?
You know, that's a great question, and I don't think anybody has an answer. So what we can do with this particular virus is we can look at history. We can look at the countries that have already had it and see what their infection curves are looking like right now. So I'll use the Hubei province of China. So they started the mitigation strategies that we're currently implementing in the United States right now on January 23rd. Yesterday, they closed the last of their 16 makeshift hospitals to take care of people with severe COVID-19 infection. Their number of new cases yesterday were very few, approaching zero. So if you look at that, that's about 8 weeks. Now, the question becomes, what happens whenever we relax these restrictions and people get back out into the environment? Won't it continue to spread? Yes, there's a good possibility. So I would like for you to not think of this as a curve, but a roller coaster. I can envision a future where we start to get on the other side of the curve, we relax restrictions, then we get pockets of outbreaks, then we need to go back into these mitigation strategies. So if you're looking for a likely path forward, I think that is a reasonable one to look at. So we follow other countries. We're looking at 6 to 8 weeks of our current containment measures, and hopefully we can shorten that depending on how much we pay attention to and adhere to the current measures we're getting from our leadership. The next 15 days is key. Are we going to follow the curve followed by South Korea, which is good? Or are we going to follow the curve that's currently being followed in Italy? Italy is a nightmare right now. The number of deaths they have are spiraling each day, secondary to COVID-19. Their medical system was overwhelmed. They didn't implement mitigation strategies as soon as everyone now would have liked. And we're seeing the tragic consequences of this. When I look at my hometown here in Nashville this past weekend and I see South Broadway just cram-packed, I see the bars jammed, I shudder because I know it's already in our community. I know that large gatherings like that make COVID-19 very easily spread. And I know that we're going to feel the effects of nights like Saturday night. We're going to start to see the effect of that in 2 weeks, and hopefully we can minimize the number of people that are going to be affected. and lose their life. So the next 15 days is key that we adhere to the mitigation strategies that you're seeing so widely publicized. Well, the biggest common internet myth that I've heard is this one. I received an email from a friend who has a friend who works for the federal government, and last night they received an email telling them blank, 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 blank. Anytime you get an email like that or you get a post like that, stop reading. I've probably read 15 of those over the past 2 weeks, and none of them are true. Our leadership is not misleading us. It's as transparent as it can be right now. So that is the internet myth that I want to completely dispel. If it didn't come from a reputable source, our governors who are heavily involved, our governor here in Tennessee, Governor Bill Lee, Governor Santos in the state of Florida, these are the people that we need to be listening to. Dr. Anthony Fauci and our White House task force on COVID-19, and especially our Surgeon General, Dr. Jerome Adams. The other internet myth I've seen is ibuprofen. Don't take ibuprofen if you have a fever. Well, that actually came from a syndrome that's been well described in the past, and it's where kids get the flu and they take ibuprofen and they get a syndrome, an adverse reaction as a result of the ibuprofen and influenza called Rye's syndrome. And that's where that myth sprang from. We don't have any proof that taking ibuprofen for fever causes that, but if you have a fever, Tylenol usually is your best bet.
What can we do?
What we all can do first is don't panic. I've never had a situation in my life where panic helped. It's not going to do us any good. So the first thing we can do is remain calm, rational, and take the steps we know can minimize the damage that we face. Don't minimize. I've seen this numerous times through various outlets, social media. This is no worse than the flu. I saw spring breakers, having a party on the beach, downplaying the significance of this. This is not a joking matter. We're not shutting down, a lot of businesses in the United States right now, just for precautionary reasons. This is serious business. So don't panic, don't minimize, and listen to our leadership. Do the things that we know work. Don't think you're the exception. You're not the exception. And treat this like that you're going to be the one that's affected with severe disease, because somebody will be if we don't do the things that we know work. So the first thing, social distancing. Keep that 6 feet minimum. Avoid groups greater than 10. This is vitally important because we know this virus jumps around very easily in crowds. Next, we want to avoid contact with anyone who is sick. If you're sick, stay at home. Don't expose yourselves to others. If you have someone in your home who is sick and you've been exposed, stay home. This will go a long way towards stopping the spread of COVID-19. Wash your hands for at least 20 seconds. If most people are like me, I go in the bathroom, I wash my hands, it's about 5 seconds. 20 seconds is a long time. So when you wash your hands, wash it good with a lot of soap and water for at least 20 seconds. So one of the ways you can do that is sing the lyrics to one of your favorite songs for 20 seconds, or sing happy birthday to yourself twice, and that'll get you covered. If you don't have access to soap and water, then an alcohol-based hand sanitizer with at least 60% alcohol. Practice good hygiene habits. Take care of yourself, eat properly, exercise. These are things we know that build our immune system and make us less dangerous to touch because we haven't bathed. Clean and disinfect, quote, high-touch areas, countertops, doorknobs, anything that people touch on a regular basis. And don't touch your eyes, your nose, your mouth after touching any of these high-touch areas before you either use hand sanitizer of 60% alcohol or wash your hands thoroughly. For our patients here at Cedar Recovery, we've set up a website, cedarrecovery.com/coronavirus. On our website, you'll find resources. You'll find local places you can go to be tested if you meet criteria. And I'll keep that website up to date as often as new information comes out. And remember, we're here for you. We're here to meet you where you are. We're here to help you feel better, get better, and stay better, no matter what. And that includes COVID-19 and the coronavirus.